With over 40 years of experience, Sedatelec provides cutting-edge equipment that is designed and manufactured in France to assist in the development of complementary medicine worldwide. A single-use semi-permanent needle, the ASP is used for extended stimulation of the auriculotherapy points. Each box contains the ready-to-use product, the ASP needles, the adhesive plasters, and a user guide, which must be read prior to any use of this medical device. This product must be stored out of the light, in normal temperature and humidity conditions. The ASP comes in 3 versions. The ASP Classic with a stainless steel nickel-free needle. The ASP Gold with a steel needle covered with a film of 99.7% pure gold. This needle is used for patients with allergies. The ASP Titanium with a needle made of solid medical-grade titanium, which has maximum biocompatibility and should be used for long-term treatments, and is highly recommended for patients at risk, such as diabetics, immunodeficient patients, or patients with multiple allergies. As it is non-magnetic, it can remain in place during an MRI examination. After detection of the auricular points to be stimulated, using mechanical feeler instruments or electrical detectors, disinfect the patient's ear. Make sure that the blister is intact and remove the injector from its packaging. Position the tip of the injector on the point to be treated and press perpendicularly to the surface of the skin. The characteristic click indicates the ASP is properly positioned. To improve the patient's comfort, you can ask her to hold her breath at the moment of puncture. When the needle is in place, it can be stimulated using the injector magnet, but only with the ASP Classic and ASP Gold. Place the magnet in front of the needle head and pivot the injector around itself, in both directions, 1 rotation per second for approximately 30 seconds. Protect the needle using an adhesive plaster. The adhesive plasters provided with the ASP are made with a microporous back and a hypoallergenic adhesive mass. The ASP Classic and Gold injector can be given to the patient, as it has a bipolar magnet on its tip. This is specially designed to periodically reactivate the effect of the implanted needle. The needle usually falls out by itself after a few days, but it can be removed at any time, if necessary, using a set of tweezers. Medical device used for implanting a small needle in the ear speculum, the ASP is comprised of a unitary applicator to make it easy to insert the needle with excellent precision and to guarantee perfect sterility. A standard setter in auriculotherapy, it can be used to treat any type of chronic or sharp pain, addictions, mental disorders such as stress or anxiety, and various functional disorders, efficiently, precisely, and simply. For more information, please visit www.sedatelec.com.